It's clearly the most successful community development model that we've delivered. The others have all had their own merits. This one has had greater impact and greater reach into communities for minimal resource. Well, a community builder is a page role, and it's a really important page role because they have to be very skilled on a number of different levels. It's a role where they need to be able to engage with lots of different people, but very much listen and make the connections with people, but make connections about what's going on locally and nationally, politically. They also have to follow through the ABCD approach. And they start their role really by recruiting the community connectors, who are effectively volunteers but might not even recognise themselves as volunteers. They're just people who, have a conversation, a real conversation with the community builder and asked what they care enough to do something about. And, that all kinds of people who wouldn't have considered themselves to go down a traditional volunteer route do feel passionate about something, potentially that's affecting either themselves, a close family member, or directly in their neighbourhood, and want to rectify that. And the connectors are basically invited to start to build that solution, and the community builder supports them and links them with organisations and others that want to also work for that common purpose.
It's very mentally challenging, connecting and having to remember what people care about, what their names are, what their project ideas are, and what their issues. It's a constant challenge. You're always having to remember who cares about what to make those connections. It's emotional. It's an emotional job. Because you get to know what people really care about and what their skills are, you do hear their struggles and their passion. And sometimes that comes from a bad place, or would they say a sad place. The main activities is street walks and outreach and engagement and going along to these places and actually meeting people on the streets. That has to be, for me, at least 60% of your work. There's a lot of creative engagement techniques that have to be involved, because not one technique works for one particular group. So if you're going to a youth club, you can't use the same approach as you would going into an over 50s club. A lot of one-to-one support is needed. There's a lot of meeting people at cafes or in their house or in informal settings. It's that constant support and that constant motivation that keeps the project going. I think if that doesn't happen, nothing would happen. Mediation. Your aim is to make the community more closer and tighter, and there's always going to be complications and issues within that community. It may be that they've been fighting for the same funding, or it may be that citizens don't particularly get on with this particular group in their community. And your role as a community builder is to make everybody as involved and welcome. Project management, there's a lot of project managing other people's projects until they feel comfortable and confident enough to get up and do it themselves. That's quite hard. One of the main things that our mentors have told me around ABCD is to never do for somebody else what they can do for themselves. Event organising, usually it's around 12 events over an 8-month period. But only about 5 or 4 of them are major events. The rest are small, informal gatherings and meetings, just enabling the local organisations, associations and residents to get together and support each other. And always stay in solution focus. There's several times you'll be in a meeting and people get into that deficit kind of, okay, well, this is the problem, this is the issue. So it's having to always turn that back into the glass is half full rather than half empty. And lastly, asset mapping. It's a constant thing you're always doing. If I hear about a project or hear about a person or hear about a resource, I'm always trying to find out where that is and making sure I record that information.
I originally became involved with ABCD projects through using our local family centre that I take my grandchildren to. I was asked to become a connector and try to involve people in community projects.
Shirley took me to a connectors meeting and I was sitting there and someone mentioned depression. and I thought I'd like to run a group for people with depression because I've suffered with it for over 20 years. And now I have actually been funded by ABCD and set up Face to Face, which is help for depressed people or people feeling down from someone who has felt like them before.
One idea came up that there were some young people saying that they felt that the older people don't like them. They felt that they were not respected by the older members of the community. And so we sort of talked about ideas of how they would be able to solve that as a problem. And some of the kids said, well, maybe if we had a club where the older people can come into our club and they can have a look around, or, you know, they can see what things we do. Maybe we could do activities together and stuff, maybe work on a computer and do arts and crafts and card making and things. And that's taken on immensely. It's just managed to get so many, between 20 and 25 elderly people coming in and mixing in with, like, you know, equally numbers of young people, and they've just got on and taken part in different activities and teaching one another how to use the computer or just to play games and things like that. There's just so much for them to learn from the elderly people, and vice versa. Elderly people have learned how to go on the internet and order shopping. A young person said that there's a lot of elderly people that are not connected by social media and networks like that. So this young person decided that he felt that it would be good if we had like a newsletter that went out across the community, and the newsletter's been developed, and the first one went out to the New Addington Carnival. We've got a cooking project. We've got young people that have overcome fears of like touching meat or eating in front of people, and so there's been lots and lots of really good positive developments that have come out of that. Young people that have to be quite independent, either because their parents have got disabilities, or some of them, their parents are not around much, work quite long hours and stuff, and so these young people have to pretty much make their own evening meals, and 9 times out of 10 have said they'll have beans on toast, cheese on toast, because they don't know how to cook. So we've sort of like introduced lots of different healthy foods and stuff like that, young people saying, I've never tasted a tomato, and it's quite shocking that you think, oh my God, just something as basic as a tomato, but yeah, or not knowing what a kiwi was and things like that. So there's been lots and lots of personal development for these young people just doing the cooking project, not even just talking about health and safety in the kitchen, the budget, you know, how much it costs to buy these meals and what they're making and what would cost. How can we keep the cost down low, but we want, you know, them to be able to have the healthy food. So they look into all of that and plan all of that in each cooking session. So while they're waiting for their food to cook, they'll be planning the following week of what they're going to cook and what they think would work and what they'll learn from it budget-wise and stuff like that. Some of the young people have helped the volunteers to go and get the shopping. So it also gives them an insight into where do you go, what do you use. Just help so many young people and help them to improve their lives, really, I think, because especially now when they come in and say, yeah, last week we made prawn or chicken chow mein. They could choose what they wanted because I wasn't sure how they'd be with prawn. And they were like, I actually went home and made it for my dad. Like this young girl, her mum died, so she just lives with her dad. And she said, like, we don't normally have food like that or anything. She said, but she went home and told her dad all what stuff we used and everything, bean sprouts and all the different vegetables that we put in and stuff like that. And she said her dad went and got it for her and said, okay, now you can make it, and show him how to make it. And she was really chuffed with herself, just so, like, and she's 12.
I'll start with the 2 projects that I run. One was bike maintenance, which in a nutshell I used the funding to purchase the rental of a workshop and also a handful of materials and equipment to repair pedal bikes. I then opened the doors free of charge for 2 different afternoons, and I repaired approximately 8 bikes from different young people and donated approximately 3 to other young people who come to me with bikes that were in such a bad condition they couldn't be repaired. So we had a handful in-house that we were donated. The second one I'm now currently working on is Wii Fit, and again, in a nutshell, is basically based around Wii fitness, not just around digital gaming and the Nintendo Wii, but also around mental gaming and mental fitness. So we incorporate board games like chess and Monopoly. We have football games for fitness as well. We also have arts and crafts for stimulating the mind alongside the Nintendo Wii.
Really disciplines you in who you're accountable to, in a way that perhaps other forms of community work haven't, because it's not for me to say, no, we can't do that, or the resources, or whatever. But it is very much about being invited to a meeting with connectors, or working with connectors and saying, oh, we want to do this, and actually saying, let's go and find out how that can be done, and working with it, and then being able to approach practitioners, be it in the council or other organisations, and really work with them to get a sense of how they're going to support the community, rather than how their agenda, the community, need to fit in. If we're going to create health and well-being, good health and well-being in a neighbourhood, the majority of that is going to be done and should be done by the community. You know, you can build all your hospitals, but if people don't feel safe, if people don't feel connected and feel isolated, etc., that's where it starts.
Well, before, community involvement that I've been involved in has always been responding to people's problems and focusing on their needs and aim to fix people. So it's this very top-down approach of we're doing to you, and it doesn't encourage people to be proactive. People get used to, okay, well, you're going to come in and fix my problem. It's this a deficit approach that we've always used before, that then obviously once the project ends, people don't continue to support themselves because you're no longer there to fix it for them. And it's enabled me to work differently in a more community-driven way that mobilises the community by focusing on their strengths and what they've got to offer, rather than focusing on, well, this is the problem, this is the need, and never getting to the solution.
I met with Janine and we agreed she would do a one-stop shop here on a Tuesday and a Friday morning. So we sort of set that up. We've done the flyers for that, we've done leaflets for it, set up the mapping, etc. for that. Then what I agreed we would do is we would text message our patients the week before and the day before, just to see sort of what response there would be from that. And we did that the first week they was here. Absolutely brilliant. There was about 30 people in the morning turned up to see them. So there was 4 of them out there actually that morning, very busy, people in, people out. Come to me and said it was fantastic. And again, it just raised our awareness of what was going on locally. The doctors might get an elderly patient in, sort of depressed, bored, live on their own, don't socialise. So if they're aware of the local community projects, they can signpost patients like that to them, which will then help the depression, help their low moods if they're out socialising. I think it's helped all round, and the GPs do. You know, I update them in our clinical meetings, and we've got a list of the services, local community projects when they're on. So we do signpost, and that's been the last few months we've been involved in that. Yeah, it's been great.
To be really honest, it felt very vague at the beginning. It just felt like we couldn't get our head around what was involved with the project. But after having attended a couple of meetings, we realised what a valuable service that would be, because it would help us connect with everybody within the community and thereby help the community as well. Some very good examples of how we've managed to connect with the community through the ABCD project. At Easter, the Samaritans had a Health Watch week, and our pharmacists were able to go in there and be able to give a talk on the services that the pharmacy is able to offer. And also our medical counter assistants were able to go in there and offer blood pressure measurements for a week and also connect with the community. So that,
from my point of view as a connector, I speak to my pharmacist regularly because my husband's pretty ill. And I connect with her, and she's actually asked me in September, she's going to be offering the flu jabs in the pharmacy. Rather than have to go to the doctors and make an appointment, she can do it there. And she's asked me if she gets the leaflets printed, if I can give them to the people that come to Energetic and Wise. That's a 2-minute conversation when I was getting a prescription myself. So the amount of time that's going to take off the GPs, through me just saying to the older people at my group, go to Fieldway Pharmacy, go to the chemist, she can give you your flu jab. She can help you give up smoking. She can do your blood pressure check.
Another benefit of the ABCD project has been the opportunity it's given us to meet with our partners in the GP surgeries They're giving us a very relaxed way of working with them and better communication, better relationships, and I think that can only be better for the patient and the community in the long run.
A lot of the ABCD initiatives have been sort of funded top down, and there's a lot of goodwill towards it, but it doesn't necessarily mean that the organisations, the funders, have really challenged their own culture that says you have to move out of the way. You've funded this, you've got to let the builders, the connectors, and most importantly the citizens come with the solutions and the activities, etc. That's a huge cultural shift. I think what organisations will very quickly find out is actually people do care, they do want the best for their neighbourhood, so it's a win-win situation. Because you can't say, right, we want community-driven initiatives, we want community involvement, and this is how we want it to look.
We need to fund people to become self-reliant, to become self-sufficient, to support their own communities, and that's where we'll make a real difference. But there's a real risk that people won't see that, and they will look at the budget and say, no, we're not going to look at prevention.
Well, a lot of people have said it's just a big society initiative and it's about, making people do things for themselves when really the government should be doing it, and that's usually the first response I got when I first started working in ABCD. And my response was, well, it's not really about them, it's about you. How do you feel when you're connected in your community? And when people started to actually look and be like, actually, well, I do want to be close to my community and I do want to do something. And it's not about being frustrated, and actually I am in control. It made a massive difference.
There's a great moment when you're with people who've been asked, number one, what they care about, they're passionate about in their area. So they own it, so it's theirs. No one's telling them, no one's saying what's wrong. And then asking people to share their gifts. And that's probably one of the most powerful things, when people suddenly look and see all the things that people are so generous and wishing to offer towards their community. And just that sense of, actually, we can do something here, rather than this, our area's bad, our area's poor, our area's problem-ridden, all these sort of things. Actually, look what we can do. So there's great moments like that where you really think, actually, this is a real force for positive change, and you do feel that you're part of that.
Encouraging people to be proactive and building confidence in people. I mean, I've started with some connectors who could hardly talk to somebody new, and now they're going to CCG meetings and standing up and telling them this is what our community wants, and it's really amazing to see that confidence and for people to take that power back in their own hands.